I want to say thank you for having me here. It's a great pleasure. And thank you to all of you that have come out here to join in this important conversation today. So I am going to start by sharing my screen. All right, can everyone see? Even though I cannot see you, if someone can unmute.
Yes.
And just thank you. So I just want to first start out with, I want to get to know who's in our audience today. So how many of you work in academia? So if you want to just in the chat, put in academia, and also what is your role? Are you faculty? Are you a dean? You don't have to say your institution, but I just want to know. I see you, Kenya. Hello, Jill, faculty. Okay. Mostly faculty today, adjunct. VR simulation author. Okay, great. So most everyone on this call is in faculty. All right, so let's get started with our discussion. So let's talk about what we know so far and what we've been hearing for years and years and years is that we need to increase the diversity of the nursing workforce and also in academia. And this is something that's been said time and time again from either AACN, the National League of Nursing, National Academy of Medicine, ANA. We know this. We know that we don't have enough faculty of color or nurses of color in the workforce. And let's look at some of the statistics. I'm not going to bore you with a lot of statistics, but we need to look at the numbers. We know in the United States, Black Americans make up 13.6% of the population. But let's look at when it comes to nursing. Only 6.7% of RNs are Black. And we look at our students at the baccalaureate level, particular, 11%, still not at that 13%. And even more dismal is when we start looking at our doctoral students. We're looking at only 9% of our doctoral students are Black students. And then let's look at the faculty and our nurse educators. Again, only 9%. So we have a lot of work to do. And when we look at the attrition and graduation rates, that's even more alarming. 40% of Black college students graduate with a 4-year degree within 6 years, even giving them 6 years, it's still 40. And when we look at the numbers of the other races, 74% of Asian students graduate within 6 years, 64% of white students, 54% of Latino Hispanic students. And it makes us think, why? It's not that we're not capable, it's not that we're not able, but we need to look at what are those challenges? What are those barriers? And then just looking at our community colleges, again, still a high attrition rate, 18 to 20%. So we're going to dig a little deeper. And we also know it's important. We need to have a workforce that represents the population. And our population is getting more and more diverse. People feel comfortable when they can look up, whether it's a student, whether it's a patient, and see people that look like them. They have a better understanding of their needs. They understand because they have a shared lived experience. They tend to be more compassionate, provide better patient care, better bonding. Patients trust and students trust when they see someone that looks like them. And that reduces their fears, that reduces their stress, and improves patient outcomes, quality of care. Because if I trust you, and if you're giving me, excellent care, I'm more likely to follow my prescribed regimen. I'm more likely to go to get my preventative care. And when there's racism in the either education or in the healthcare system, I'm less likely. I'm not going to come back to you for preventative care or to come to you necessarily when I have a problem because of the unfair and unjust treatment that I receive, the discrimination. So we know that racism leads to higher morbidity, mortality rates, and exacerbates the health inequities that we face. And these patients, again, they face students, bias, prejudice in these institutions. So why? We know that there's been a shortage. We know that there's a lack of diversity. Why in 2022 are we still talking about this? Why does it still exist? And we know when it comes to education, we have inequities in our education system. I'm talking about from as soon as we enter kindergarten to college. And historical present day racism impacts our recruitment, impacts the retention of students of color in the health professions. Unfortunately, we live in a society that fails to recognize that these disparities exist in our educational system, particularly for our students of color, and they create significant barriers even in the nursing programs. And it's not that, there was a belief at a time that we didn't have intellectual capacity. that it was too challenging for us, and that is absolutely not true. But we also got to look at our application process. There's bias in our application process. Our admission procedures and policies are restrictive. When we look at how we're admitting students and looking just at test scores or looking at grades, that's not the only factors that we should be using to make a decision whether someone enters nursing school or not. And then when it comes to, again, Black students, admission, and even looking at the progression policies that we have in place, we are very strict a lot of times with grades and assignments. And we know that students have challenges when they're in nursing school. It is life. I've had students that have dealt with health issues, homelessness, different things. And sometimes we're so rigid in our policies that we make it very difficult for students to be successful. So let's look at particularly the experiences. We're going to talk about the experiences of students. But we also need to talk about the experiences of faculty of color. And one of them is, and I've been in education now for probably close to 20 years. Sometimes Black faculty, we work in toxic environments where we're not respected by some of our students, some of our colleagues, and even some of our administrators and deans. And this includes, we face microaggressions. I think we all probably have a story that we could tell. We're a student of faculty of color. Character assassination, lack of support on some of the activities and the scholarly activities that we conduct, our research studies, acts of incivility, and just not having the same opportunities for career advancement. And when we look at the research, and some of the people on this very call right now have done a lot of research in this area, and you interview faculty of color, these are some of the words that come up in a lot of these articles in this research. We feel devalued, underappreciated, dismissed, invisible, silenced, voiceless, discouraged, disrespected, rejected. How many of us have been in rooms with our peers where we make great recommendations or add to the conversation to be dismissed when someone else can rephrase it and all of a sudden it's a significant finding or idea? This happens a lot of times to faculty of color when we're in academic settings. And also, as people of color, how many of you, again, another chat question, in the past 2 years, you have been asked to take on additional DEI-related initiatives? And that could be asking to be a mentor, to provide some kind of DEI education, to running a DEI task force. How many of us have been given that added responsibility? And a lot of times these added responsibilities that we're willing to take on because we do want to make a difference, but they can often go unappreciated, or they add on to the work responsibilities that we already have, which can interfere with our progression to promotion or tenure process. And again, we are not here. It's a lot of pressure too. Thinking about the emotional toll it takes when we got this pressure that we're supposed to solve all the problems at our institution when it comes around race-related issues. Now let's look at the experiences of our students of color. And again, looking in the literature, some of the same words come up: frustration, incivility, underrepresented, lonely, isolated, misunderstood, alienated. And we need to look at, what do our students of color face when they're in our institutions? And they will tell you stories, overt and covert acts of racism. They experience subpar clinical learning experiences, constantly being questioned and quizzed by their faculty. They experience their own microaggressions, and that's coming from fellow students, to patients that they're taking care of in a clinical setting, to faculty. They face their bias, prejudice, their own internalized bias, and they're being subjected to an education that is riddled with its own stereotypical case presentations and race-based medicine and other issues with our curriculum, and not really addressing the true cause of health inequities. And then there's the failure to address racism in nursing. Students may present these problems, these challenges, and then they go unheard. Nothing is done. And what message does that give our students when they're coming and they're actually presenting these problems, these issues, and there's no resolution? Again, feeling like they're not heard. And then let's look at the barriers we have in our educational system. We have policies and practices, which are discriminatory when we're talking about, again, admission process to progression. Inadequate emotional and moral support for students, insufficient academic advising, lack of faculty support, and failure to create an inclusive environment for our students. These are all barriers that can lead to that high attrition rate that just reported. And then let's talk about the financial challenges. That's a very big point of why students are not able to successfully complete nursing programs sometimes. Is because nursing programs are expensive. And a lot of times students may be juggling trying nursing school. They need to have employment in order to pay their tuition or to pay the bills. A lot of people have families, they have tuitions, they have mortgages. And we have nursing programs a lot of times that say, well, you shouldn't be working while you're in our program. Well, how are the students gonna survive if they're in the nursing program, if they can't work and they don't have scholarships or a lot of loans or financial help? It makes it very difficult. And then you're trying to balance, again, a very rigorous curriculum with work, with family. These are all barriers and challenges. And then also, when we look at the students of color, there's that lack of mentorship. And research shows that faculty commitment was the key to success for student retention. And also, like I said, coming from people that look like them. They tend to be more supportive. They express a genuine interest in the students because, again, they've probably been through similar situations. They share their experiences with the students and how they overcame their challenges, and they provide recommendations for academic success. So enough about, we talked about the challenges, but now let's talk a little bit more about what can be done to combat some of those challenges, both from an individual standpoint, but also from an institutional standpoint. One of the first things is we need to create a more inclusive environment, not only for students, but for faculty, for staff of color. And that includes somewhere where people feel respected, they feel a sense of trust, that people have a cultural humility, that we know it's not just cultural competency, it's a one and done, but a continuous learning about different cultures, continuous learning, equitable reward and recognition system, both for, again, faculty and for students. And we're all working towards a common purposeful goal, that we feel like we belong at these institutions, and we have equal access to opportunities. And the importance of DEI practitioners. And this comes from a great article. I see Dr. Fields is on this call. If you haven't read this article, it's in Dr. Beard. We need to have DEI practitioners, and whatever you call them at your institution. They could be deans, which highly recommended, directors, officers, but someone that's going to keep DEI at the forefront, that has a responsibility, dedication at the institution, so that it's not just a fad. And even though everybody should be working on DEI, shouldn't be just in the hands of one person, but this person, this practitioner that we're calling, can help develop new DEI initiatives, evaluate existing policies and practices, develop diversity programs and education. We have book clubs, and we have all kind of, every month we have different cultural celebrations. They support community-based organizations that help support equity. They're role models for our students, for other faculty. They help develop nursing curriculum. They evaluate nursing curriculum to make sure that we have health equity threaded throughout. They promote DEI initiatives. They help with recruiting, not only Black students, but also Black faculty. And they serve on the institutional strategic plan to make sure, again, that DEI stays at that forefront. And these individuals not only just have the position, but they need to have the power to make change and not just be there to put out fires when there's any race-related issues. And then we need to look at our systemic practices and policies at our institutions. And again, we start with the individual, but if we want to have the biggest impact, we need to really affect those structural, systemic, racial policies that prevent us from getting to this goal of having a more diverse workforce. So these organizations, we need to practice what we preach. If they say that they want to have DEI, they say they want to recruit more students of color and faculty of color, what are they doing? And what are those metrics? Are we seeing that they're meeting that goal? And if they're not, why not? So although people say DEI, they still have old practices and policies in place that create those barriers that we just talked about. So I say one of the first steps, listen to the faculty and students from these historically excluded groups. What do they have to say? What are those barriers for them? First, identify it, and then we can work to solve some of those issues. And they need to be part of the conversation and be at the table when we're making these decisions, these changes. And one of them starting with just looking at our mission criteria and the use of standardized tests for nursing programs. We base so much on that, but we know that students come with so many different strengths. So instead of looking at what they don't have, what they're not able to achieve, what are those strengths that they can bring to the program that we're not looking at? And again, this was about the mission process. It's another image. And then we need to have some really tough conversations, and we need to create a brave space for these conversations about race, about oppression, about privilege, and they need to be explicitly named and addressed. And these are not comfortable. We all probably deal with faculty that, we don't touch it because it makes us uncomfortable. We don't feel like we have the knowledge or the skills to bring up these conversations. Or we feel like because we might come from one of these privileged groups, we don't have the right to talk about things such as racism and privilege. But we need to have these conversations. And it's important, again, to first understand the experiences and the challenges that these students go through navigating these predominantly white institutions. But then we need to have compassion about the experiences these students face and hear about the discrimination, the bias, the microaggressions that have these negative effects on our students. And if we want to fix it, we first got to know what's wrong. And so this will help to create that more inclusive environment. And then let's talk a little bit about education and training. And again, going to the chat, how many people, let's say in the past year, have gone through some kind of DEI? It could be implicit bias training, how to address microaggressions, cultural awareness. How many of you in the chat have gone through some kind of training the past year? Good, I think we all have. But again, this isn't a one and done. It's not checkbox. We've had somebody come to the school and talk about it. Oh, I have somebody that said no. Okay. Institutions need to really be dedicated to having this kind of training for everyone, school-wide. That shows their commitment, and not just talking about diversity, equity, inclusion, really even more so anti-racism. That takes it to the next level. So it's important that faculty, they develop a cultural awareness and sensitivity for students from different ethnic groups in order to gain an understanding of the problems faced. And then as individuals, let me go to the next one. One of the things, sorry, I think I missed a slide, is we need to look at ourselves. How many of us are doing our own work? It's great to have all these, programs, but we also need to identify our own biases. We need to know what our own privileges are. We need to work on deconstructing our biases and the reject the prejudice that we may have about certain populations and this belief that students are unable to be academically successful, but to understand they can be given the right tools and resources. So it's really important that, yes, you go to the training, but as an individual, what are you doing to be a better person to address, because we all have biases. So what are we doing to address those? And you have to actively work at it. And just going to the chat, helped establish DEI funds for nursing students. Thank you, Linda, for sharing. Marifa, we are providing the training to the university faculty, staff, yes. And that's great that institutions are doing that. And again, doing it for everyone and doing it on a regular basis. We should not be stopping these types of trainings. They should be going on a continuous basis. And then let's take it even a step further. yes, it's great to have all that education, but are you truly an ally? Are you truly practicing anti-racism? And again, it needs to be on everybody's agenda, something that everybody is working on, not just the DEI officer or the faculty of color. So one of the first things is just to be your own DEI champion. Serve on diversity inclusion committees. Be a part of different organizations that promote diversity. Are we also working on initiatives, making a conscious effort to work with other faculty or other personnel that don't look like you? Are we collaborating with do the work and collaborate with people who are not like you, supporting faculty of color on some of their projects and initiatives. And then most importantly, we have this saying in New York for the subways, if you see something, say something. Well, I say the same thing about DEI. If you are in an environment where you're witnessing racism, discrimination, bias, whether it's towards a student or a faculty, are you just turning your head and not acknowledging it? Don't be silent when you witness these microaggressions or whatever at your institution. Say something about it, because that sends a message that it's not just their problem, but you're also addressing it. Do you have a system where you can report if you see discrimination? And one thing too, don't minimize the experience of people that come and say they feel a certain way or they experience something. And one thing I learned, I don't know if Bart's on, and one of the ways we can address it is by calling it out. When we see it, say something to the person, do something about it, or calling in. And there's like a lot of other strategies. We had a great workshop early on in the ECHO about how to mitigate bias, how you can address it in a way so the person hopefully doesn't become defensive, but you do bring attention to it, because the only way that we can help resolve it is we have to acknowledge it, name it, and that way we can help to come up with a solution. And at an institutional level, we need to incentivize DEI initiatives. So I know at our institution, for example, we have anti-racism provost grants that are given out every year for different projects that address DEI or anti-racism. So implementing specific grants is one great way. Also, advocating for initiatives that support diversity and equity. And then the people who are doing the work, make sure they're acknowledged, they get that recognition, whether that's in the form of they're going towards promotion or tenure, that's given the same value as other activities, or when it comes time for the merit increases, if you have individuals who are working on that, keeping that in mind, that they're doing the work and make sure that they're receiving recognition for that work, because a lot of times we don't. And then as nursing faculty, we need to take a closer look at our curriculum. And again, a question I'm going to pose to the group. How many of you all educators, have had discussions in your class about social determinants of health? I'm ready to say most yes. Health equity, implicit bias. Okay, it's going to get a little tougher. How many of you had discussions about racism, the historical context behind racism, why it still exists? No, a couple no's. How about white privilege? Have you had any discussion or even used that word in your class? White fragility, white privilege. No, I see some no's, I see some yeses. Very happy to see some yeses in the conversation. Again, tough conversations to have. And because people, we have this fear, we might say something wrong. I don't want to offend people, okay? But these are the conversations. It's easier, I should say, to talk about social determinants of health. It's easier to talk about implicit bias, but we need to get a little bit deeper. Are we really talking about the cause, how that contributes to the poor health outcomes? And as a profession, again, we need to move away from a culture of talking about it to really implementing an anti-racist curriculum. It talks about the impact of racism on patient outcomes. We talk about power and privilege. And we talk about, most importantly, what are the strategies for dismantling inequities in our healthcare system? That's what students need. If they see something in a clinical setting, for example, what tools are we giving them to empower them that they can address some of the racist things they're seeing in their clinical setting, or something that was said by a healthcare practitioner, even though they're a student? How do they address that? Or if they want to advocate on their patient's behalf because they see they're being treated unfair. Are we giving them those tools so that they can be empowered to be a health equity advocate? And are we making sure that DEI is truly threaded in all of our courses? It's not just sitting in one course. It is something that each course should be talking about. And let's look a little bit deeper. The curriculum that we already have in place. Are we still teaching race-based medicine? If we look at our case scenarios or our simulations, are there stereotypes embedded in those that are perpetuating racism? And are we really getting to the point where, again, we're teaching students how to call out? And let's look at our clinical settings. Are we sending our students all to these, very private hospitals with in nice neighborhoods? Or do we give them a variety of clinical settings where they're going to see the effects of social determinants of health? Something to think about. We need to really examine our nursing curriculum. And I see the chat is on fire. Let me just read a few comments. We have yet to infiltrate our curriculum and colleagues. Great. One of the professors in my graduate program asked me if it was okay to attend Black nurses conventions. Very interesting, because she is a PhD prepared. We'd love to see more, just because it says it's a Black Nurses Association. We want to see diversity. What better place to learn about Black culture and the issues that face Black America, but go to these conferences. There's nothing wrong with that. Everybody is welcome. I ensure that all simulation exposes DEI anti-racism throughout. Thank you for sharing that. And then we need to look at what are we doing to increase the amount of students of color that are going into nursing and becoming nursing faculty. So institutions must make a conscious decision and put effective strategies in place to commit, truly commit to recruit and retain students from diverse backgrounds, and truly commit to recruit and retain faculty of color. And this can be done numerous ways. Sometimes we call it pipeline. I've been now told to call it pathway programs, where we're looking at students, and not just high school, because I think sometimes we focus too much on high school. We need to get these students even before high school. What are we doing to promote school-age children, middle school, so that they can think about a career in nursing? So having those programs. Matter of fact, I am in New Orleans right now as part of an orientation for a Robert Wood Johnson pathway program called the Summer Public Health Education Program, where we recruit students from all over the United States to come for a 6-week intensive summer program. We need to have more of those programs. We need to have them right in our neighborhoods. And then we also, let's look at attrition. What are we doing so that when we admit the students, that they're going to be successful and they're going to graduate? So the reasons we talked about that our students of color have higher attrition rates because of the lack of social connection, financial challenges, lack of faculty support. What are we doing about that? Are we providing financial support? Are we providing scholarships? Are we looking at grants, loan forgiveness programs, all these things? Hiring more Black faculty to assist in providing academic, social, and cultural support for these students. All of us probably have some sort of I'm sorry, my alarm is going on. And of course, it doesn't want to stop. And Black mentorship programs for helping to retain not only students, but also faculty, because we know the mentorship role is very important for encouragement, support, sponsorship. And diversity needs to excel not only in the student body, but also faculty and leadership. And this helped when it comes to faculty, helping with research proposals, with writing manuscripts, with assisting with promotion and tenure process. These are all important. All right, so now we get to the scenario part, and let me see if I can turn off this ringtone. Okay, worst timing. So now we're gonna get to the scenario. And Unfortunately, this is a scenario I feel takes place a little too often. And this comes with when we have students of color and we're providing academic coaching or counseling to these students. So here's our case for our breakout rooms today. We have Patricia Johnson, who's a 34-year-old junior nursing student. She's married, she's got 3 kids. She works part-time as a patient care technician to help cover the cost of her tuition, but also she has rent to pay, bills to pay, mouths to feed, and her husband also works. However, it is challenging. They really paycheck to paycheck since she's been in school. She has a 3.1 GPA. However, having difficulties this semester in particular because juggling work and school and care of her family has been exceptionally challenging this semester. And in this med surg class that she's in right now, she's gotten 2 75s and she has like 1 more exam and she needs to get a 90 in order to pass the course. So she's on her last, right before her last exam. She just got a 75 on her final, the last exam she took. The instructor has called her into the office to have a discussion with her. So this is where it's going to take place. It's supposed to be, it's on Zoom between Dr. Clark, who's the professor, and Patricia Johnson, who is the student. So I'm going to go ahead and bring up that video. But before I go on, let me just see if there's anything else in the chat. Okay, expired. Okay, great. So let me stop sharing and let's go to the video.